Hi, this is Paula Davis-Lack, Doctor of Nursing Practice, doing a full head-to-toe physical exam for EMU's 220 health assessment. And I have my patient here today. Can I get your full name and date of birth, please?
Maria Fernanda Patricia Esteva.
And date of birth, please?
August 13, 1957.
All right, thank you so much for that. And do I have consent to touch your body? I'll be touching all your arms. I'll be looking at your belly. Do I have consent for your touch and for this physical exam?
Yes, you do.
Okay, so we've confirmed our patient, gotten our 2 patient identifiers, made sure we had the right person, and obtained consent. So we're going to go ahead and continue with our physical exam. All right, first and foremost, can you tell me where you are today?
I'm in my house.
In your house. Okay, and who's the president?
Biden.
What year is it?
2023.
Okay, and why are you here today?
I have pain in my belly.
Pain in your belly. All right, thank you so much. So
With some disturbances when sometimes I'm constipated and sometimes I have diarrhea.
Okay, all right. Well, we'll do a full physical exam and focus on the belly for those concerns today.
Thank you.
All right, so I'm going to go ahead and get started. I'm going to start by flashing a big bright light in your eyes. So look straight at my nose, okay? All right, Perla is intact, 3-2. They were a little bit sluggish, and I did notice some cataracts in her eyes, and that's something that you were already aware of, all right?
Yes, I do.
Okay, all right, go ahead and just follow my pen light with just your gaze. Okay, and follow it in. Try one more time. All right. So, again, cardinal gazes were intact, telling us that cranial nerve 2, 3, and 6 were intact. Her eyes actually did not accommodate very well. We tried it twice, and so we can say that her Perla was mostly intact, but did not perfectly accommodate, and that is just fine. All right, that's a kind of normal abnormal for her age range. All right, so I'm going to go ahead and continue with my physical exam. No pain with that?
No pain at all.
All right, no tenderness or bogginess with frontal and maxillary sinuses. Okay, I'm going to go ahead and assess your lymph nodes. Preauricular, postauricular, submental, suboccipital, posterior cervical chain, anterior cervical chain, and supraclavicular. Okay, any tenderness with any of that?
No.
Okay, none of those lymph nodes were boggy, inflamed, so we don't have to worry about them. And as I've been watching her, we're going to continue with the neuro assessment. So go ahead and give me a big smile, big frown. Stick out your tongue. Move it side to side. All right, so with that assessment, we can say that cranial nerve 7 and cranial nerve 10 are intact. All right, go ahead and open your mouth and say ah. All right, go ahead and lift up your tongue. All right, great. So she did have a slight little white coating on her tongue that we'll take note of and a little bit of redness in the back of her throat, but there was no exudate. We're feeling a little bit under the weather.
I've had a cold for 3 months, but it's just disappearing right now.
Okay.
It's going away.
So, that kind of falls in line with what we say. So that's why patient history is always very important before you do a physical exam. All right, I'm going to go ahead and assess your trachea. Okay, trachea is midline. I'm going to go ahead and assess her thyroid. All right, no thyroid megaly or prominent nodes. All right, go ahead and swallow for me. Say ah. She had no vocal quality change, so we can assume that she is safe to swallow. All right, now I'm just going to take a quick peek at your arms, your neck, and your legs. All right, no concerning lesions on her skin, and we'll continue as we continue with the physical exam, we'll keep checking that. All right, I'm going to go ahead and assess your carotid bruits. So what I'm going to do is I'm going to flip my stethoscope over to the bell, and as I place my stethoscope, you're going to take a deep breath in and hold. Or before I place my stethoscope, you're going to take a deep breath in and hold it, okay? So take a deep breath in. And go ahead and relax. All right, no bruit on that side. We'll check the other one. Deep breath in and hold it. Great. No bruit on either one of those sides. So we're going to continue with the cardiac exam. I'm going to listen to your heart, okay?
Okay.
I'm going to flip my the stethoscope back over to the diaphragm. So aortic, pulmonic, Erb's point, tricuspid. We're going to go up and under for point of maximum impulse, and mitral valve. Okay, she had S1, S2 without click, murmur, or rub. So we're going to go ahead and continue with our chest assessment. I'm going to listen to your lungs, okay?
Okay.
So you will be taking 6 deep breaths on the front, 8 on the back. So if you need a pause.
How do you mean, how do I take breaths on my back?
You're going to take a deep breath as I move my stethoscope.
Okay.
Thank you for asking a clarifying question. So I'm going to go ahead and take a deep breath in and out through your nose every time I move my stethoscope. So go ahead. Okay. 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 All right. And if you can move your arms just a little bit, big deep breath in. Go ahead. Same thing, in and out. Great. So anterior lung sounds were clear, auscultation, no adventitious sounds. I'm going to go ahead and palpate your chest. All right. Nothing abnormal that I'm feeling, no abnormal lumps or bumps. I'm going to go ahead and percuss your anterior chest. Okay, no dullness or hyperresonance to percussion with that. All right, so I'm going to go ahead and do, go ahead. All right, so I'm going to go ahead and listen for, or palpate for agophony or bronchophony. So you just say E and 99 for me.
E.
99.
99. E. 99. E. 99.
All right, thank you so much. So since we're in this lovely chair, we're just going to rotate you away. And if you can lean forward for me, great. So we are going to listen to 8 places. So if you need a deep breath, since I can't see your face, just go ahead and give me a hand up, okay?
Okay.
All right, big deep breath in and out every time I move this. Let's go.
In through the nose and out through the nose?
In and out through the nose, yep.
Okay.
Okay. Okay. Okay, I'm going to give you a break for just a second, and then we'll listen to 4 more places. All right, ready?
Ready.
All right. All right, last 2. Last 1. Okay, great. I'm going to go ahead and percuss your chest, so go ahead and continue to lean forward for me.
So percuss means that you're going to tap on it?
Correct, yes. And I'm also palpating, again, no abnormal lumps or bumps, and then the same thing. You're going to say E and 99.
E 99. E 99. E 99.
Okay, so I did feel some increased tactile fremitus up here in her other lobe, so I'm going to switch my hands just to make sure it's not a me thing. So go ahead and do that one more time.
E 99.
And it did resolve when I flip my hand. So sometimes that happens, just that your hands are slightly more sensitive. So always double check that if you do find an abnormal. I'm going to go ahead and thump on your kidneys. Any pain with any of that? Little tenderness?
Not real pain, just feeling the bump.
Okay. All right, so go ahead and put your hands flat on your lap. I'm going to go ahead and check your pulses. Radial pulses are +2 bilaterally. Cap refill is less than 2 bilaterally. I'm going to go ahead and assess her dorsalis pedis, which is behind her ankle, and posterior tibialis. I'm sorry, dorsalis pedis, which is on top of her foot, and posterior tibialis, which is on her ankle. And both of those are +2. I'm going to assess for edema, nor pedal or pretibial edema. I'm going to squeeze the back of your, no pain with any of that?
Yeah.
Okay, great. Toes up to your nose. Push down like you're pushing on a gas pedal. Squeeze my fingers as hard as you can. Squeeze, squeeze, squeeze. I'm going to pull you, resist me. I'm going to push you, resist me. Great. Go ahead and lift the knee straight up. Don't let me push you down. Great. Go go ahead and close your eyes. We're going to play a game. It's called Am I Touching You? I'm going to touch, with, and you're going to tell me if it's sharp or pokey. So we're going to go ahead and get started, okay? Am I touching you?
No.
Am I touching you?
Sharp.
Okay. Am I touching you?
Yeah, but different than the other one.
Okay, so soft.
Yes.
Okay. Am I touching you?
Yes. Prickle.
Am I touching you?
Softer. Yeah.
Okay.
Yes. Prickle.
Okay.
Touch.
Is it soft or pokey?
Soft. Yeah.
Okay. Soft or pokey?
Soft.
Soft or pokey?
Soft.
Okay. All right. So, sensation was intact on her face and on all 4 of her limbs. So at this time, I'm going to have you just relax back for me a little bit. Just lean back as far as you can. I'm going to uncover your abdomen, take a look, a listen, and a tap, okay? All right. Stethoscope is going to be a little cold.
It is.
All right. Bowel sounds are normal, active in all 4 quadrants. I'm going to go ahead and percuss. All right. Any pain with that?
No.
Okay, I'm going to go ahead and lightly palpate. A little tenderness over on that right upper quadrant?
A little.
Not too bad?
There, a little bit more.
All right. So left lower quadrant, actually. All right, going to go ahead and go a little bit deeper.
Okay.
Any pain with any of that?
No.
I'm going to push right above your pubic bone. Any pain with that?
Yep.
Okay, great. So all right, so her bowel sounds are clear to, normal, active in all 4 quadrants, no hyperresonance to percussion, no tenderness with light or deep palpation. I'm going to go ahead and assess your abdominal aorta. So I'm just going to flip my stethoscope one more time, sneak my little stethoscope up and under. Great. And I was able to hear bowel sounds, but I wasn't able to hear a bruit. All right, so for this next one, we're going to do 2 extra tests, and then we'll be all done. So one is called Romberg. All you're going to do is you're going to
How is it called?
Romberg.
Romberg. Is
You're going to
somebody's
stand
last
up.
name?
I believe so, yep. Usually they name the test after the people that made them up.
Okay.
All right, so what you're going to do is we're going to assess if you are a fall risk or not. So you're going to stand up, you're going to close your eyes, and we're going to wait for 5 to 10 seconds, see if you lilt side to side, and if you kind of fall or stumble, don't worry, I'll have my hands out to catch you.
Sometimes I feel that when I'm in the shower and I close my eyes, I feel that I'm going to fall.
So then this is even more important to make sure that we do this today, to make sure that you are safe to continue by yourself.
Thank you.
The last part that we're going to do, but after we assess that you're safe to do our gait analysis, will be a gait analysis. You'll start by walking away from me normal. You'll come back to me on your tiptoes, go away on your heels, and the last one will be a tandem walk, where you put your arms out in front of you and you heel-toe walk. Okay. And don't worry, I'll give you all those instructions again. So we're going to go ahead and start with Romberg. So you're going to go ahead and stand up. I'm going to adjust my camera. All right, go ahead and close your eyes. 1, 2, 3, 4, 5. Go ahead and open your eyes. So Romberg was negative. So we're going to go ahead and I will switch the camera for the gait analysis. So go ahead and just walk away normally. Okay. Come back on your tiptoes. Tiptoes.
Tippy-toe.
All right. Walk away on your heels.
Hurts my knees a little bit.
Okay. Hurts your knees a little bit, but the back's okay?
The back's, yes.
Okay. And now you're going to come back with a tandem walk. So arms out in front of you, crossed. And then heel-toe walk.
Heel.
So walk, yep, put one toe in front. Yep, there we
toe.
go. Perp walk, yep. Okay. Keep going. Okay, great. All right. So we're going to go ahead and summarize Maria's abnormal findings today. So Maria, you did have a slightly abnormal gait analysis. You did have a lilt with a tandem walk, but that's okay. You were safe to stand with the Romberg, so that dizziness and lightheadedness you experience in the shower could just be from the heat and vasodilation.
Yeah, that's what I thought. I like hot showers.
Yeah, so you might want to install a grab bar just for safety, just so you have something to grab onto in the shower. Other abnormals, she did, her bowel assessment was a little bit tender on that left lower quadrant. Nothing really to be worried about with that, but we'll definitely keep that in mind based on, you know, kind of what brought you in today. Your lung sounds were excellent. Your cardiac assessment was also excellent. So everything was copacetic. So Maria, thank you so much for letting us do this physical exam today.
Well, thank you for joining me.
All right. Bye now.